Good afternoon. My name is Jennifer Olson. I want to welcome you back to this afternoon's discussion that was started by another Dr. Jennifer, where we are diving into practice and field experience in this vast and complex communications space. So I have the pleasure to introduce our three speakers. First, we'll be hearing from Kacey Ernst, who's an associate professor at the University of Arizona, focusing on assessing environmental and social factors related to mosquito-borne diseases. Second, we'll be hearing from Nick Van Praag of Ground Truth, who's had significant experience in humanitarian and development work, working for groups like UNHCR and Aga Khan and the World Bank. And then we'll hear from Damien Chalad, who's the executive director of the World Federation of Science Journalists, and will bring forth his experience from various broadcasting entities, BBC, CBC, Denmark's, and Radio Canada, amongst others. And so I will now leave it to Dr. Kacey Ernst to get us started. Thank you.
Thanks for having me here today. So full disclosure, I am not a risk communication expert. I think I'm what you would call the domain expert. I learned that this morning. I'm actually an infectious disease epidemiologist, and I work primarily on vector-borne diseases, including dengue, Zika, and malaria. And so today I'm going to talk a little bit about a process of learning that I have had in working with the Center for Disease Control as well as Global Threats Fund to develop a community-based surveillance application that we call Cadenga. And I'm going to talk a little bit about some of the challenges and opportunities that I have identified as this process has gone along. So just a refresher here, this is a nice timeline that was put together by the World Health Organization that shows how the Zika pandemic has sort of unfolded. And you can see that, there were a number of, back historically, we've had certainly cases of Zika that have cropped up in multiple places across the world. But as the timeline advances here, 2015, 2016, the tremendous growth in the number of geographic areas that were affected in a very short amount of time was rather staggering. And there are some specific challenges that came with trying to communicate as the Zika pandemic unfolded. One of the things that I'm very interested in is how you can ensure vector control. So one of the difficulties with this transmission dynamic is that Aedes aegypti are highly invasive. This is not something that can be purely a top-down control effort. There are very few places where you can have the sort of militaristic campaign that would be required to eliminate all sites of Aedes aegypti breeding and infestation. And so one of the roles of communication that I see in this instance is to engage community members and household members to actively seek out and reduce the habitat of this Aedes aegypti mosquito. Another issue with the Zika pandemic is the high level of asymptomatic and mild cases. And so really trying to get people who have a mild syndrome to actually seek care and get tested is not very common, unless that person really seriously believes that they are at high risk for having contracted Zika from other risk factors that they've encountered. And so one of the premises of the platform that we built is for people to actually report in syndromes that they are experiencing. Another issue that we have faced is that it's rapidly emerging to new locations. And being able to identify and relay when and where first cases originate and areas with highest risk for future emergence is another big issue that communication streams need to face with the Zika pandemic. And then there's a high degree of uncertainty about transmission risk and rapidly evolving scientific evidence. Although there have been historical cases of Zika, quite frankly, we knew very little about the actual disease. The fact that it has a sexually transmitted component is something that is very new. There have been no other instances where a vector-borne disease, a primarily vector-borne disease, is also sexually transmitted. And the dynamic surrounding how you can communicate both of those risks simultaneously has been a great challenge. And so communication streams have to be very fluid and timely, and they have to be able to dispel these rumors that have been brought up throughout the sessions this morning as playing a critical role in affecting people's response. So I did a little bit of an investigation on what is currently in the literature on social listening with the Zika pandemic, and this idea of rumors and how they get spread through the course of a pandemic. And what you can see is that in this article by Dretz, they found that if you actually plotted the information that was circulating surrounding Zika vaccine and anything related to vaccination for Zika, it mirrored very well the ones that had pseudoscientific claims. So most of the evidence, most of the information that was being posted did not have great scientific evidence surrounding it. Another sort of important point is that in this article by Sharma, they indicated that useful information, which was posted, there's a large number of posts there, 81% of posts were actually useful information, and 12% were misleading, misguiding information. But what they found, if you go down to that fourth line, is that the misguiding information was shared at a much higher rate than that which was useful. And so I think thinking about this in a broad context of how can we get that information to go viral, if it were that we want to, is something we all have to face. And so to try and address some of these communication gaps that are surrounding broadly 80s-borne diseases, which honestly, this platform that we were developing was in the works before Zika actually sort of hit the center stage. And one of the things that we thought about is we wanted to develop a community-based surveillance system in which we identified clusters of people who had syndromes and maybe get some early warning to the public health departments that there might be activity that was starting to crop up. But one of the things that I was really interested in and keen on was that this not just be a platform to solicit information from people, because quite frankly, if you're asking people for something, you also have to be giving them something in exchange. And so some of the things that we talked about providing them were this sort of, as we talked about self-efficacy and development of sort of the ability to take action. That was a big part of what I wanted to do, was to really try and give people information that would allow them to act in a way that would help reduce their risk and their community's risk. And so the idea and premise is that if you have people who are better educated, who have more self-efficacy, who are more empowered, they're going to be more likely to take some sort of public health action. And at the same time, when you have this coupled with the community-based surveillance piece, maybe you are able to identify early signals that say that there's transmission that's occurring, and that will signal the public health department to do something. And working together, we can flatten this epidemic curve. So because this is a platform that addresses not just Zika, it also addresses dengue and other 80s-borne diseases. Right now, it may be expanded to other mosquito-borne diseases more generally. And one of the things that I have been thinking about is that, you know, the kinds of information and the kinds of platform that you have to use may differ depending upon what the actual infectious agent is and what class it is. If it's a novel pathogen, which I would classify Zika as, because quite frankly, we had very little scientific information about it at the time. Some of the challenges are that rumors will be high. Media attention will also be high, which can be a good thing too. But uncertainty from science and public health experts is also high. And the opportunity is that risk behaviors may be more readily modifiable because people are going to be more open to listening to information about it. With the emergence of an established pathogen into a new area, Some of the challenges might be uncertainty from science and public health experts being moderate as to what is going to happen when it hits a new location. But there's also lessons learned from other places that you can exploit and bring into this new environment. And then things that are seasonally transmitted. So dengue, for example, in Puerto Rico. Some of the challenges are that there's message fatigue. People hear the same messages again and again and again, and complacency has set in, and it's not really making a difference. We're still seeing dengue, and so that complacency may be hard to surmount. However, there are well-established best practices, there's lower levels of uncertainty, and hopefully the knowledge base in your community is a bit higher. So I see that you can develop some synergies among these different communication modalities that I've been speaking about. If you have an active social listening platform where you can monitor for these rumors, where you can determine what the health concern priorities are, so what are people talking about that they're really worried about, because there's this mismatch, as was mentioned this morning. And then also trying to figure out, okay, well, are people actually talking about the things that I'm presenting through my specific platform? And then also you can use that platform of bidirectional communication to address those rumors and health concerns, and to provide tailored risk awareness from participatory surveillance, because you have that all geographically located. And then participatory surveillance can really be beneficial because it enhances engagement. You can link exposure and syndromic field data with social media feeds. And while those people who are going to actually participate in the participatory surveillance are likely quite different from the general population, they may be more interested in science, what they can be is advocates. They could be seeds. You could see them as a cohort to start spreading better information. So one of the things that hasn't been mentioned, I think, is this need to educate and entertain at the same time. I think that, you know, people, if you're thinking about the general population, this is my perspective, right, as a lay sort of risk communication person. But I feel like if you want to sustain engagement, trying to identify ways that make it fun to learn about these things, to make it exciting and to make it new. I have an idea of embedding a mosquito hunt game into the Kadanga platform to keep people engaged, give them points for reporting in, give them new weapons for fighting the mosquitoes, like you know, indoor residual sprays and other things. The other thing that I would say is a key opportunity is precision messaging. We know a lot more about people because of social media, and we know a lot more about how to get information that's personally relevant. And I think some other individuals mentioned this morning that it's really important to learn from the prophet community on how to really target those messages. Another key challenge is evaluation, and really trying to figure out how well we can evaluate these, not just on a do people like it, do they change their perceptions, but does it actually motivate action? And I think another individual had mentioned this morning that it's really important to leverage the data that's already existing. So this is a map of the mosquito collection in Maricopa County, which is extremely extensive. And you could use that in order to, you could target your messages to specific geographic areas and really test which places do they see a reduction in mosquitoes, et cetera. One of the other issues that I would just want to raise quickly is that the ethics of participatory surveillance are complex. And currently, the community-based surveillance falls between the standard regulatory oversight bodies. It doesn't fall under IRB. My IRB was deemed exempt. HIPAA is sort of somewhere out there, and the FDA does not govern this. So how do you actually balance public health action and privacy? And when do you provide public health with user information, because we're an academic institution? And then I think that the last thing I'm going to talk about, because I know I'm out of time, is this collaboration with public health. And these collaborations, as we build these systems and platforms, can be challenged by logistics and data and information exchange. This lack of a central location where all of this data is housed is a very difficult one to overcome. You have to go to each state, each jurisdiction, whose information you want to put on this, and solicit their approval and get a different kind of data stream from each one. And then how that data is going to be used for by public health is going to really, the proof is in the pudding in terms of can you actually show that your data is reliable and accurate, and can you make sure that your messaging is consistent. But it also provides opportunities for transparency, opportunities for rapid dissemination of critical and accurate information for prevention and control, and provision of early alerts and risk information. And so I'm going to end with that and just with acknowledgments of all of the individuals who have been helping me develop this platform.